ready there? Okay. Let's open the Board of Health meeting for August 23rd, 2020 at 9:01. Roll call.
Gavin Byers.
And Flipwood.
And Chris Nosella. We have one, I believe, addition that wasn't anticipated in 48 hours.
So, my addition is under 1.7, the septic permits for review. So I've got one permit, it's 538 Main Street, it's a septic upgrade.
Good man. Okay. Which one is that, Rick, again, I'm sorry?
Under 1.7, it would be 538 Main Street.
Okay, and what we have here is a request from the planning board in accordance with MGL Chapter 48 Townsend Bylaw 145-42 Site Plan Review Special Permit and 145-65 Special Permit and Art 8, I don't know what that means, but 145-33 Planning Board will be holding virtual.
Article 8?
What's that?
Article 8?
It might be. I'm not sure. We'll be holding a public hearing on Monday, September 13th at 6:45 to review application received from Michael Peretti proposing to construct a 13,439 square foot new parking spaces in 6 parking areas intercepted through County Estates condominium complex at 5 Turnpike Road. What I think they're looking for is comments. If you'd like, I'll pass this around, you can take a look at what they're doing. This doesn't really have a lot to do with us, but we'll send that down so you guys can take a peek.
Rick, have you seen this yet? Looks like they're just down in parking.
Yeah, I think right now their septic system is basically it's here, and then it comes across the street here for that building. This one is out this way, and this one I haven't done, so I'm not sure where it is. So that would be the only one that I would want to look up, but I think those two would be fine.
They're not going over the septics at all.
No,
Okay.
doesn't look so bad.
Are they gonna propose a new structure here? What are they doing?
Not just parking.
Just for parking?
Just for parking, yeah. The planning board's looking for a comment from us. I don't have a comment that really has,
Yeah, I mean, you might
nothing
want to
to-
ask for an
Yeah.
overlay with the septic locations,
Yeah.
just to be sure, so do they have it on a scaled plan altogether? But that would be really the only thing that I can think of that we would have any concern with, is to make sure they're not paving over the system, because
Yeah.
that's not how they were originally proposed.
okay,
Do you want to write that down on there, on the
Sure.
comments?
yeah, I'll give that to you.
That would be excellent.
Those systems aren't rented at all, right?
The two that they put in most recently are, the one that serves building 3, which is this one, that's an older system, so I don't even know where it is right now.
What's it?
Okay, so we are going to ask for an overlay that will give us some leverage over where they put it over the septic tanks. If they do, we can revisit. I just gave you my agenda in there somewhere. Thank you. Give Rick a minute and then we'll Thank you, sir. Okay, we're going to 1.3, COVID update.
Alright, so we'll kind of start off the same way that we have. So there has been a jump in positive cases. So the most recent report from Mass DPH was issued on August 19th, and there was 22 positive cases in Townsend over the previous 2-week period. Prior to that, on August 12th, there were 11 cases. On August 5th, which I believe was right around the last time we met, there was less than 5. And then on July 29th, there was also less than 5. As far as the vaccination numbers, they're continuing to go up, but it's at a pretty slow rate. The most recent numbers, and these were also reported on August 19th, go through the age groups and then 1 dose and fully vaccinated. So the 12 to 15 age group, those that had received 1 dose, it was 54%, and fully vaccinated was 45%. That one was a jump of about 4 percentage points for both of them. 16 to 19, 1 dose was 64%, and fully vaccinated was 55%. And that was about a 2% increase since the last time we met. 20 to 29 was 66% with 1 dose and 60% fully vaccinated, and that was about the same as it was last time. 30 to 49 was 60% with 1 dose and 55% fully vaccinated. That was roughly the same as last time as well. 50 to 64 was 78% have received 1 dose and 72% were fully vaccinated. That number didn't really increase from the last time. 65 to 74, 86% with 1 dose and 83% fully vaccinated. And again, that one didn't change very much either. And then the 75 plus was greater than 95% with 1 dose and 90% fully vaccinated, and that was the same as last time. Looking at the total town population, 62% have 1 dose and 57% were fully vaccinated. That was about a 1 percentage point increase from last time. And then comparing that to this county level, 62% are vaccinated in Townsend with 1 dose, 73% is the county number, and then the state number is 71%. And then for fully vaccinated, Townsend was 57%, the county was 67%, and the state was 65%. So still, lagging behind those numbers a little bit. There was a little bit of other news that came out relative to COVID since we last met. The first thing was, and I think Carla had forwarded at least to Chris and maybe to Jim and Gavin, about the 3rd dose that CDC had come out and recommended. So we're still waiting on information as far as everybody who's received the 2 doses of either Pfizer or Moderna. There's going to be a recommendation coming out at some point for those, but Mass DPH did take the first recommendation that CDC gave, which was to provide a 3rd vaccination to people that have some sort of immunocompromised situation. So those were people that had active cancer treatment for tumors or cancers of the blood, organ transplant, stem cell transplant, moderate or severe immunodeficiency, advanced or untreated HIV, and active treatment with high-dose corticosteroids or other drugs that may suppress your immune response. And it really didn't change much from what you guys had ended up putting on the website. It's a little bit meatier, but it essentially says to consult with your doctor, and they would make the recommendation, and it sounds like the preference would be to have your doctor's office provide the vaccine there. So it's not going to look too different than what it was, and we'll have to just wait for what they come out with for that 3rd one they recommended, which I think was 8 months after the last dose that you had received. And the suggestion was that it be the same mRNA vaccine that you had previously gotten, but if it's not available, you could go get the other one, if that is available. And then as far as the schools, the last time we had met, you guys had made the recommendation to the school committee that all the students K through 12 be masked and staff as well. So I passed that on to Brad Morgan, the superintendent, and they were supposed to actually meet today.
This
Yeah.
morning, but it was postponed. Did you see that?
I saw that, yeah, so I think it was because I had forwarded him this press release, and I'm assuming he probably got it too, from the Department of Elementary and Secondary Education. So the Education Commissioner, Jeff Riley, had asked for DESI to grant him the authority to mandate masks for K through 12. So basically, exactly what you guys had suggested, and that if it goes through, I think it's tomorrow, then that would be effective up until October 1st, and then they would look at it again, and if school districts met a certain threshold, I think it was 80% of vaccination for students and staff, then they could make the decision to not wear masks anymore. Anything below that, it sounds like would continue to have that requirement. I think that's kind of all the COVID updates since the last time we met, but if you guys have any questions, we can.
Does our 20 people put us in the red?
So they don't have that chart anymore, but when it existed, it was 25 would have put people in red. So 20 would have been yellow,
Yellow, okay.
22 would have been yellow.
Okay, we're getting close to recommending masks in the town hall if we go into what would be red. I don't think we need it yet, but we are getting close.
Sure.
I think it's gonna happen eventually.
Yeah, yeah.
So we can, when the numbers were low, we've kind of gotten away from me giving you an update weekly, but I'll start
Yeah,
sending them to you on Thursday again, now that they're starting to creep up again.
yeah, I appreciate that. That's good information, Carla. We did tell Ross that we would update him when we got information. Can you send him an email, letting him know the numbers and where we're at so far? That'll keep him in the loop as he requested.
Sure.
And, all right, anything else?
That's everything I've got, so if you guys have any specific questions, I can try to answer them, or at least get you the answers. But that's pretty much what's happened since the last time we met.
What's the feeling as far as other towns and their increase in vaccination percentages compared to us? Are the other towns kind of in the same boat that we're in as far as increasing the amount of vaccination?
I'd have to look, so I can tell you Ashby and Ashburnham, which are the other towns I cover, are pretty similar. Their vaccination rates are a little bit higher to start with, but as far as an increase, it's moving at about the same rate, so it's pretty slow, and most of the vaccinations are the same as yours. They're coming in that 12 to 15 age group, for the younger kids that just couldn't have gotten it before.
Right, okay.
What are the numbers in Pepperell right now?
I don't know. Oh, as far as positive cases?
Yeah.
I can look it up. If you guys want to move on to something else, then I can tell you. But last I checked, they were quite a bit higher than ours.
Okay.
Okay, let's move, for now, let's go to 1.4, 96 Fitchburg Road, manure management plan.
I don't think you're ever gonna see a manure management plan because
I
now
don't
the
either.
property is under contract and it appears that the property will be sold at some point.
Is it, well, it's under contract, which is pretty much, purchase and sales has been signed, I assume.
Yes, there's, Rick, do you wanna talk about this for a minute?
Yeah, there's supposedly two separate people that think that they have a purchase and sale on the property. So, we won't get involved with that, but hopefully one of them works out. And, because I have a soil testing application from one, and then another's been in contact with Carla regarding the eviction process. So we'll let them sort that part out, but it seems like one way or the other, somebody's gonna own the property shortly.
Because of the hectic activity, why don't we just say, well, it's for our next meeting, maybe we can update.
Yeah, we'll keep it on the agenda. Oh, goodness me. Okay, let's go to 1.5 while we're waiting on Rick. Stable regulation update. What do we have?
I never looked at this regulation, so I am a bad boy.
All right, we'll continue that one on to the next meeting.
So I kinda narrowed it
Yeah.
down to 3
Yeah.
that I like parts of.
Yeah.
I kinda wouldn't mind.
Would you like to discuss it? That's
Well,
fine.
just real quick, I
Yeah.
wouldn't mind, getting an electronic copy of these, if I can, Rick, that I can edit and maybe put together a combination of the 3 of these, and I can let you know which ones.
Was there, yeah, if you wanna let me know which one, cause I can get the ones that I have.
Yeah, they're the ones that
The
you
other
gave
ones
us.
I'd have, so those were all PDFs,
Okay,
but I might be able to get Word documents from the towns if you tell me just,
Yeah.
which ones you like.
okay, yeah, cause there's a lot of stuff that I like, but each individual plan I don't like on its own, but there's a lot of good stuff, within 3 of them, so I kinda went through them all, weeded out all the redundant stuff, and kinda mentally put together one piece that I really liked. It might be a little long, but we can cut it down
Yeah.
later on, if you want, so.
Be like our trash contract.
To do that, or do you want me to ask the
Like
town?
that.
Oh, yeah, I'll try to get them, if you tell me which ones, then, I'll
Yeah,
reach out to the
it's
town
just
and see if
the Stowe's plan, Harvard, or Stowe's plan, Ayers plan, and Ashburnham.
Okay.
It would be a good idea to take his suggestion and we just review those 3.
Yes, I think that will save us a lot of time. You seem to have a good handle on it.
He's a good man.
And it's been
We'll take your lead on this one.
kinda perusing
Yeah.
through it, so.
Excellent, thank you, Gavin.
Yeah, thank you, Kevin, very much. Okay, we're going to 1.6.
Just to go back, so Pepperell's at 43 cases, so they're
43?
about double it right now.
Wow. Okay, that's concerning as far as the school goes.
Yeah, so hopefully, like Brad had said in the email, hopefully they'll give that, power to the, education, I can't remember his title, but
Yeah.
the commissioner there, and then, they'll be able to monitor it and make a decision, and hopefully we see the vaccination rates go up. I mean, the other thing you could do is, you could recommend to Brad, so they can have, they've got mobile vaccination buses that can come in, and they're through DESI, and they can offer the vaccinations to the kids at school. And I don't know if they did it, I never saw anything from Brad that came to me that said that they had the buses still out there.
I haven't seen it.
Yeah, but it's something that you could recommend to them, to see if they wanted to take part in that program, to kind of bump those numbers up a little bit.
That would just be basically for the kids and the teachers, I assume.
Yeah, I mean, they could open it up to anybody, but really that's what they're concentrating on, is the students and staff.
Okay. What do you think? I think that's actually not a bad idea.
I think
Doesn't
it's a good
hurt.
idea.
Does it, it's free from the
It's
state?
free for them, yeah.
Yeah, so I think
Yeah.
we,
They could even go around, I think the school is a great place, but also into the baseball fields. Wasn't there talk of that, Rick?
I hadn't heard I hadn't really heard from Brad for a while up until recently.
I heard that there was talk about the athletic fields, that you would get a lot of families and young children being at the sporting events.
I think a lot of the concern with getting the vaccination is that people have some planning in mind when they're getting it, because some of the people have like the after effect where they're kind of down and out for a couple days. So the people that I've talked to with kids that are gonna be vaccinating them, they're worried about when to do it. So they wanna do it toward the end of the week, so if their kid is sick, or has a reaction, it's gonna be a Saturday or Sunday that they're down and out versus missing school and causing a little bit of a commotion. So,
that makes a lot of
It
sense.
does make sense.
Yeah.
yeah, so like bringing it to so 2 of my kids go to school in Templeton, and Narragansett did the same thing. They had the bus come in and have 2 events right at the end of the school year. And they were early in the week. One of them was early in the week, the other one was late in the week, and the one late in the week, they had more people show up for.
Mm,
So that might, that's something to kind of think about.
Yep, I think,
recommend having the bus at the end of the week.
Yeah,
Yeah.
I think that's something we probably should do. Why don't we, Rick,
Okay.
send Brad a letter saying that we think it's a good idea that they have the bus come in, maybe on a Thursday or Friday, if possible, to make vaccinations available to the students and anyone else that needs it. Okay. That will take care of actually our COVID update, I believe.
Yeah, that'll finish that one up.
Okay. Let's go to 6.1. 321 Townsend Hill Road septic failure update.
That was 1.6, not 6.1.
Oh, my dyslexia must be kicking in. 1.6.
So this one is, we've gone through the list of septic failures that were past the 2-year period for upgrade, and one of them was this 321 Townsend Hill Road. So we had sent them out by certified mail. This one ended up coming back, and Carl and I really weren't surprised, because I was under the assumption that the owner had passed away, and the property's somewhere in probate, but nobody's doing anything. They owe quite a bit in back taxes and everything. So I don't know what you want to do with this one, but there's really no point of contact at this point, so it probably makes sense to let it sit and let that get sorted out, and then we can address it once there's an owner to do that with.
I will send a letter to Vicky and Jody, asking them to check the transfers and when they see it come through, to let us know, because then we can let the new owners know.
Yeah.
Good idea.
Okay.
Okay, so that takes care of that one. We'll go to 1.7, septic permit review for, and that is 538 Main.
538 man. So there's just a couple of minor things I'm waiting back from the engineer, but he was hoping that you would be able to take a look at it. He had originally proposed this as a 3-bedroom system, and it ended up being a 2-bedroom house, so they couldn't increase flow without proposing something in full compliance. So it's just, right now they've got a cesspool right next to the foundation, and they're looking to put in a 1,500 gallon, 2-compartment septic tank, and then that'll gravity feed to 2 leaching galleys. And so the revisions that I'm waiting for are, he had 3 galleys for the 3 bedrooms, and so it's just a couple of typos. So if you guys are okay with it, I will hold the permit until he gets those back to me. But they are asking for a couple of local upgrade approvals. So one is the setback from the wall to the septic tank. So that distance right there is 10 feet required. They're requesting that 3.3 feet.
3 feet.
And then the other one is the location of the water supply line, which is coming in here and then coming through and into the house at that point, from 10 feet down to 2 feet. And the reason why he's asking for it is because the gas line's right here, and the water line's right here, and the septic line comes out right here. So without really locating utilities, that's the only spot that the tank can go, and he's kind of splitting the difference a little closer to the water line than a gas line. But his argument was that that water line's a pressure line, so it's not going to be sucking anything in. If there is a leak, it's going to create a water issue, but not in the water line because of the high pressure.
What's the foundation made of?
Right there, it's poured concrete.
Board,
Yeah, so this is, it used to be, this was the house right here, and this was added on probably about 15 years ago. It's a big workshop garage.
And this is a sewer line out here coming out of the house right there?
That's it, yeah. Yeah, so right now, this kind of clouded area is where that cesspool is.
Well, let's see these additions, change the prints and all that. Look at it again, get some kind of think about it, but I think this is a no-brainer too.
So they kind of think, that gas line's, pretty close to the old cesspool?
Yeah, so they, had DigSafe come in and locate everything, so the lines that are on here is what DigSafe located.
this is one of those situations where we gotta look at what's going on for a pre-existing condition and do the best we can with the upgrade.
Yeah.
If this was a stone wall or a laid granite foundation, we might request they do something to the outside of the foundation.
Waterproof.
But because it's already concrete and it's already been sealed, that takes care of that problem.
Yeah, the other part is too, he proposed a monolithic tank, so no center seam, the seam's up, it's just a one-piece tank and they set the top on top of it.
Cool.
Yeah, so let's have them change this,
Okay.
and we'll take another look at it, make sure it's kosher.
Okay. Do you guys wanna look at it again in a meeting?
I don't think we need to,
I
as
don't
long as
think we
they,
need
Cause
to.
I did type a permit up,
we can
Yes,
put
you
that
got
in the
it.
condition is,
yeah,
making sure that the drawings are updated correctly.
okay.
Do I have a motion on that?
Go ahead, Jim.
I'll give it to Kevin.
Oh,
Me to do it?
Yeah.
I'll make a motion to approve the interim plans for 538 Main Street, the septic upgrade pending edited.
You can
Edited
reference, so
plans.
I wrote him an email on August 20th, so you're
Okay.
pending revisions addressing the 820 email.
All right, so pending revisions for the 820 email.
And that includes the two variances they wanted?
Both,
Okay.
both water line and septic
Right.
variants.
can I get a second?
Negative.
All in favor?
Aye.
Aye.
Aye. Okay. And that will take us to invoices. Rick, I think we are all set with you.
Alright, so Gavin, I'll try to get you over those 3 regulations.
Thanks, no rush either on that.
I'll see you tomorrow, Rick?
Yep, and I'll write that email to Brad about the bus.
Yes, okay.
I know how much
And
everybody
I will
loves
send an
signing.
email
Even
to
if
Ross.
it's the PDFs, can you send me the PDFs? 'Cause
Yeah.
I can
Yeah.
extrapolate what I need,
Okay.
that's fine. Don't spend a ton of time
Okay.
looking for anything. Thank you.
Okay, moving on to 1.8 invoices. Cal,
I don't have any.
wow,
I'll grab,
No money going
I'll grab
up,
the
that's a good-
permit and then I'll give it back to you once I get
Okay.
everything.
Okay.
Alright, thanks guys, have a good one.
See ya.
thanks, Rick.
Yes, I don't have any
That'd be better.
invoices.
Well, okay, let's go to 1.9, the recycle center updates, including the new bulk container, concrete pad, jobs, etc.
Is the engineer still working on this one?
He has not gotten back to me, so I'm just assuming that he hasn't got the quote yet. I mean, we did meet Friday morning, so if he was going away for the weekend,
Are you referring to the drawing?
I'm referring to the quote
Oh,
of
the
how
quote to
much.
do the drawing.
Yes,
Yeah.
that's what I wanted to have for the
Mhm.
meeting
That's
tonight.
100% correct in my opinion.
Yes.
Because that's what you need, obviously, to give to the people for the quotes. Fifth Generation Masonry also wants to quote on it.
Mhm.
You do have 3 quotes already, but where they're from the town, I think that they're gonna be very competitive. There was a death in the family, so they asked for 2 to 3 weeks. If you don't have the site plan, I see you continuing this anyways, until you
Yeah.
get it, so hopefully you'll get something from him. But I did print out both the proposals if you wanted to look at them and offer any feedback.
Mr. Chairman,
Yes, sir. No, I'm just looking at this, and you said we have no invoices.
That's what I was looking for.
I have 2
You
invoices. All right, let's, as far as that goes, we'll
We'll go
come
back
back
to,
to
yeah,
the
let's go back to.
invoices. Yes, Jim, go ahead, please.
to take 3 estimates
Yeah,
with it
without
on
drawing.
verbal dimensions,
Yeah.
no elevation, no
Right.
nothing,
Yeah.
until we actually have a set of drawings
That is
that
correct.
we can issue to people,
To bid on.
nobody
Yeah.
can be competitive giving us a price.
No,
Because they've
it's
gotta
all
be, they've
speculation.
gotta be bidding on the same job.
I agree.
So I think that even looking at this stuff is just a waste of time this morning.
No,
We gotta get that drawing, so just like building a house, we
Yeah.
want it 42 by 38.
Yeah.
Period.
Mm.
Not 42.6, not 38.1.
Yeah.
This way they're gonna give us equal estimates for the same job.
That
We
is
can decipher
Yeah.
which one we feel is the most professional and we wanna go with,
That is correct.
okay?
I agree. So what we will do is we will keep that on the agenda for possibly next time if we do get a quote from Stan to do us a drawing.
Yeah.
And if that's who we decide to go with.
In the event that the engineer comes back and does give Carl a price for the drawings, is this something we can do on our own, at our free will and accord, and just make a determination, tell her, okay, we're gonna do this, do that, so that we see the drawing, and then we can put it out to bid?
Absolutely. Yes, that's the way it should be.
Okay, good.
Yeah, because just having them send it out there doesn't help us because we're the ones that are improving the recycle center.
Mhm.
We're the ones making the decision on the size of the pad, what we're gonna do. We need to see what we want done, not what someone else wants done.
Correct, and by each one of them having a drawing, they're gonna give us a
Yes.
bid on the same job.
Yes, and we can actually request 4, 5 sets, whoever we decide to send out to bid.
Mhm.
Now, let's talk about the cost, because you're gonna have to approve it. Do you wanna set a limit right now?
Can't.
Not until we really see a drawing to know what we're,
Well, you have to receive a quote. He's not gonna do the drawing until he says,
Right.
I'm gonna do it for X amount of money.
right.
You're talking
Oh, just,
the
From
price
Stan.
for the drawing.
For the
Yeah.
drawing, correct.
So originally it was like $11,000.
Right, and he said it was gonna be nowhere near that.
Yeah.
So,
Yeah,
if it's okay, and I'll check with the accountant to make sure that this is okay, but I could call you,
yeah,
and then I could call Gavin, and then I could call Jim and say, are you okay with this? Because I don't wanna wait another 2 weeks.
Yeah.
I would hope that we'd have the drawing at the next meeting.
My suggestion there is, I don't have a clue what he's gonna charge to draw that single drawing, and I'm not even gonna shoot in the back to say it's gonna be 1,500 or $5,000, I don't know. But if it comes back at $5,000, I still think that's way too much.
yeah.
Okay,
And if it comes back at 1,500, that could be doable, what's he missing, what's gonna be added to the drawing?
okay,
So I think the drawing needs review
okay.
prior to going out to bid.
Okay.
oh, absolutely,
So,
yeah.
okay, so I can work with him, and when he comes back, you're looking at, definitely less than 5,000, you'd be happy with 1,500. But we don't really know,
Yeah.
we're
You
not
gotta-
the expertise in
You
this,
gotta
so.
see the estimate before you
Right.
can even determine, because I have no idea where it's gonna be.
Okay.
And what are we telling him to draw up?
He went
That-
down
we-
to.
We haven't, did he go down there and
He
check it
did,
out? Okay.
he did. I met with him at 7:30 or 8 on Friday morning.
Okay,
We walked all around. We went through the back. I showed him where the containers were that we wanted to move out back. I showed him where the new bulk container will go. We talked about how much he would need for the pad, and he said that he was gonna go out and measure the containers themselves, so he would know, even though we said 35 by 65, he says, I'm gonna measure it myself. And he wanted to do the property lines, so he said, I can't believe we've never done this.
It's, in my opinion, a simple thing, but we're not looking at an engineer that's overseeing test holes, overseeing perk
Right.
tests,
Yeah.
bathrooms.
He didn't think any of that needed to be done.
Yeah.
All that stuff is essentially eliminated.
And
Yeah.
there
So
was
this
no
is basic.
wetlands either. When we walked the area, he said, there's no
Correct.
wetlands, we don't need to go to the planning board, we don't need to go to the conservation, this is gonna be a very simple, inexpensive plan.
well, that's nice to hear.
Inexpensive
So-
plan sounds very good.
Instead of-
And,
Cool.
All that additional work he'd be doing, he just saw the site, so he's already charges for the sidewalk, puts it on paper, sends it to us, so it should be a reasonable estimate.
Now, are you familiar with Stan Dillis?
No,
He does a lot of work in town, a lot of work. I've seen him through the planning board, and actually, I think he was here once.
Mhm.
And he's very reliable, and he's very easy to work with.
Yeah, professional also.
Yeah.
Okay, so we'll wait for that, and we'll continue to,
Yeah, we'll stay
collect
on the
another
agenda.
quote.
Mhm.
And the job situation is on the agenda for the selectmen on August 31st. So we will be there.
And what time
Chris
is
and I.
that one?
I don't know yet.
Oh, You don't have a time yet?
Not off the top of my head.
Okay, thanks. Very good. Okay, so that takes care of the recycle update. Jesus Christ, I can't talk this morning. should have had that second cup of coffee. Future agenda items, septic regulation update, work session in September. And our next meeting is the 13th of September at 9 AM at Memorial Hall.
And do you wanna go back to your invoices, Mr. Chairman?
Yes, I think that would be very good.
So unfortunately, this is a really hard one for me, but it is the overflow bag contract, 1/3 of the bags that we get, we have to give to Shaw's, which amounts to $3,200 out of the general revolving account. But the good news is Saturday we need another $1,050, so this is the third week in a row we have grossed over $1,000. It's absolutely maddening.
That's great.
It's just maddening how busy it is over there. So, that is that. And then I bought some Sharpies and some crates to store my year-end financials. I have them all in crates for each year, and it's really nice, because then I can just pick up the crate and all our financials are right in that box. So I bought another 3, so I won't need them for the next 3 years, and that was $40.46 for Staples. And that is all that I have for invoices.
So this is just for June?
No,
I was
that
gonna say,
is,
we sold over 3,000 purple bags in June.
we sold 3,255 bags.
Yes.
Okay, they get $1 for every
No, I
bag.
get that, but is this just for June?
No, it's for the whole year,
Oh, okay,
the
that's,
whole year.
oh, all right. Jesus,
So
I
they-
thought people were going crazy in June or something.
No,
Oh, okay.
But in June, did you see that we hit, in July, it was like $2,800 or something in revenue for the overflow bags? So that's just gonna almost cover this for the whole year.
Really?
Yeah,
That is good.
yeah, they really are, it's a wonderful program. And I'm so happy that I don't have to roll the bags anymore and it's in someone else's hands and I just get the monthly report. And if you notice on that invoice, they also were going to charge for the green bags, for the trash.
I thought we were
And,
gonna
yeah, I
agree
reminded
not to.
Glenn, and the accountant didn't know.
Oh, yeah.
So he absolutely honored that, and he picked those up for free. So,
Yeah, I was gonna say, I thought that was always.
Yeah.
Yeah, that was part
and
of the
we
deal.
did the calculations on how many bags, it was 93 bags were sold. If you look at 33, we were looking at you can't really go by weight because it was the debris that was on the side of the road, so it's gonna really be light. So working with Tessa, we came up with, it was about 15 yards
Oh,
of
wow.
trash that the people picked up around town. That's pretty cool.
Yeah.
Pretty good.
I know
So-
I do my street multiple times a year.
And I'm sure next year it will be just as good.
And maybe we'll have Earth Day.
And if we do, well, yeah,
Maybe.
it's such a big what if.
Yeah. Especially with the cases going up, that
Mhm.
scares the hell out of me. All right, so, can I get a motion to close the meeting at 9:39?
I make a motion to close the meeting at 9:39.
I'll second.
Okay, all in favor?
Aye.
Aye,
Excellent.
thank you.
Okay, I'm running down to